Connected.
Hey,
Hi, hi.
how's everyone?
For over 30 years, IFCO has worked in solidarity with our friends in the Caribbean in general and Cuba in particular, and focused on Cuba because of the wonderful gifts we've received from our Cuban friends. One of those many examples includes Cuba's commitment to sharing its medical gifts. And that is exactly what Cuba is doing now as the world grapples with the vicious and deadly coronavirus pandemic. We are so happy that you have joined us this evening, and we want to hear your questions. So we want to make sure that you know that toward the end of the evening, we will be entertaining questions. This wonderful panel that will be informing us, enlightening us this evening. And my co-host, Dr. Rosemary Mealy, will be sharing a little bit more about who we'll be hearing from in just a moment. But know that we want you to take note that you can use the Q&A box. It's either at the bottom of your screen or the side of your screen, at least for those of you who are joining us via video, to list your questions. We want this to be not only an opportunity to hear about the work that is happening here, thanks to the wonderful work of many of the ELAM graduates. We'll be hearing more about that, but also in Cuba. But we also want to talk about ideas, strategies, ways that we can collaborate to address some of the disparities that many of us are fully aware of when it comes to the issue of health in the United States in general and coronavirus in particular. So please relax, welcome, glad you're here. Looking forward to a robust conversation. And I'm going to now introduce my co-host, Dr. Rosemary Mealy, who is an author and professor, longtime Cuba solidarity activist, and a member of the IFCO Board of Directors, just to mention a few of the hats that she wears. Rosemary.
Good evening, and thank you, Gail. And again, welcome to all of you who are participating in this special webinar, IFCO's 30 Years of Solidarity with the Cuban Revolution, Community Action Responses to the Intersection of Coronavirus and Race in the United States. Some of you may be questioning, what are the connections between these two featured themes? Well, tonight, with all of the invited participants, we plan to show in concrete ways how two unique phenomena, one in which a country was transformed through a revolutionary process, and second, the impact of a global pandemic identified as COVID-19, which has devastated the global economy and cost the lives of more than 200,000 people. Our reality in the United States, one of the most developed capitalist countries of the world, has unmasked as we witnessed a shambled and disorganized healthcare system designed to drill out massive corporate profits instead of having a national coordinated healthcare system designed to meet the needs of its citizens. Structural inequality and racism lies as the primary reason for this disproportionate number of Black deaths during this pandemic, where race and gender are factors embedded in analyzing structural employment, access to housing, environmental racism, and historical traumas. In real time during this epidemic, who comprises the thousands of essential workers who are also deemed now expendable workers? The pandemic further exposes the racist, historical, and generational practices of structural inequality and how Black and other marginalized communities are impacted and suffers more from this pandemic. Yet 90 miles away, there lies another alternative, which we may not be able to replicate at this time, but certainly, as you will hear from other panelists, we can learn from through mutual cooperation if the United States government would respect the sovereignty of that nation. I would now like to introduce Dr. Mary Bassett, a New York native, is currently director of the FXB Center for Health and Human Rights at Harvard University. Dr. Bassett was a former New York City Health Commissioner. She will now share with us her perspectives on the impact of COVID-19 on the Black, brown, underserved communities and any recommendations and strategies for addressing the issue. Welcome, Dr. Bassett.
Thank you very much, Rosemary, for that kind introduction and for your wise words. And thank you to IFCO. And I've been a long supporter, and I'm very pleased to have the opportunity to speak with everybody who's online. There were 100 people last I looked, and there are probably more now. So thank you for joining us. And we are in the midst of a historic and still unfolding global pandemic. We haven't seen anything on this scale in a century. So it really is an incredible event that we're still learning as we go. So I'm going to talk about mostly the United States, but this clearly affects all nations in the world, and I hope others on the panel will be able to speak more to the situation in Cuba. I do need to pause and acknowledge that Cuba, despite continuing to be a very poor country, has managed to turn out health statistics that rival the United States in terms of very common measures like the infant mortality rate. And this isn't Cuba that's saying this. This is organizations like the World Bank, or organizations that clearly are not fans of Cuba, and they've been able to do this despite enduring many years of the blockade. So it's hard to believe, but it was only at the end of February that the United States saw the first death from this novel coronavirus, from a disease that's known as COVID-19. And now we stand at over 60,000 deaths. That's in less than 2 months. And that's because this pandemic is spreading at an extraordinary rate. It's spreading exponentially. It's a highly contagious virus for which we presently have no vaccine and no cure. So in the United States, it's already taken 60,000 lives. In New York City, where the epicenter of the epicenter is located, the United States is now the epicenter. In New York City, there have been over 15,000 deaths, and people think that that's probably an underestimate. But as in many conditions, these deaths aren't occurring equally across all population groups. And we, for quite a while, didn't have data made available. And it's only in the last week that the federal government has begun to make national level data available on racial disparities in the impact of COVID. And they've only made data available on the number of cases, which we all know to be vastly underestimated because the testing for COVID-19 was totally botched in its rollout and remains much too hard to obtain. But those data show that there are about nearly 3 times as many cases among people classified as Black in the United States as present in the population. So there's a disproportionate presence of people who are Black among people who are getting infected with COVID. And the Latino population also has an excess. Native American populations are experiencing COVID at 4 times the rate of the population as a whole. Additionally, we're seeing very large disparities in death. So first you get infected with COVID, and then you have a risk of death. Fortunately, that risk is relatively low, but the risk of death has been higher for people of color than other groups. And that gap can be very large. And these data were first released by local jurisdictions, cities. Milwaukee is the first place that I remember seeing it. And they reported for the state of Wisconsin, something like 14% of the population is African-American, and nearly 70% of the deaths were among people who are African-American. So in cities and states, the excess mortality has been something ranging from 2 to 3, even as high as 6-fold higher than you would expect if these deaths were occurring at the same rate. And in these press conferences that the present occupant of the White House holds, I think virtually every day, this matter was discussed. And this was the kind of comment that were made. The first person to comment was Dr. Fauci, who's widely regarded as a scientist and probably the most trusted among the people who hold forth at these press conferences. He's eminently qualified. And what he had to say about this is that we've known for a long time that African Americans have a lot of common diseases. It's really sad. They have a lot of diabetes, they have a lot of high blood pressure, they have obesity, and there's really nothing we can do about that at this point, because all we can do is try and take care of them. So that has been the prevailing explanation for why we're seeing excess mortality among African Americans and Latinos, that there are many common chronic diseases that we now know are risk factors for adverse outcomes occur more commonly, and that's true. The Surgeon General took another tack. He is African American himself, and he weighed in to, implore communities of color to step up to the plate, start looking, being more serious, look after themselves better, and get this epidemic under control. So these were the two kinds of explanations that were offered, and they're common explanations, both of which ignore the context in which people become at risk for these common chronic diseases and place the burden of overcoming conditions that make people unhappy and unhealthy on the people themselves. What wasn't raised in these press conferences is the excess risk related to getting exposed to COVID. If you look at maps of New York City and look at where the populations of color reside, these are the same communities where people who are classified as essential workers also live. These are the communities where people are rent burdened, and because of the housing crisis and very high rents, people are more likely to live in crowded apartments. And these are the communities that are low-wage communities. Something like 40% of the workforce has been classified as essential. And these are invisible workers that are at the front line of keeping things going, are in precarious employment, and are required to go to work in order to continue to be paid. If you're an essential worker, you can't work from home if your workplace decides to remain open, and you won't get paid unless you go to work. So this results in several things. First, people go to work in conditions where the social distancing or staying 6 feet apart from people who they work with is often not possible. Warehouses have assembly line-like work conditions, even washing your hands often, which is another piece of public health advice that the Surgeon General was complaining that people of color weren't paying enough attention to, may be difficult in many workplaces. People have to travel there on public transportation, which is crowded, and then they return home to crowded dwellings that may be multi-generational, because probably one of the most important risk factors for getting a serious case of COVID is being older. The risk goes way up when you hit 70 and above. So that is part of the conversation that hasn't happened at all. Another part of the conversation that hasn't happened at all in explaining racial disparities in health and the impact of COVID is the many difficulties in accessing healthcare. So for people who are hourly wage earners, they may lack any form of paid leave, no holiday, no sick leave. If you don't work that hour, you don't get paid for that hour. So when people need to pay their rent and pay for food, they go to work when they're sick. And that is not good for a highly contagious virus from the point of view of trying to control it. Additionally, when people get sick, they don't have health insurance. The United States has the distinction of being the only wealthy nation that doesn't have a plan that enables every person in the country to have health care. Our health care is often determined by our employment, and many people who are employed lack health insurance through their jobs, and people who aren't employed may not have access to it. Despite the Affordable Care Act, something like 28 million people continue to have no health insurance coverage. And additionally, people are losing their jobs. 26 million people have lost their jobs disproportionately. These are low-wage jobs, disproportionately jobs lost to people who are African American or Latino. And it's estimated that there'll be another 13.5 million people who lack health insurance because of job loss and the situation that you don't get health insurance. So you are more likely to have contact with people. That's how COVID spreads. The more contacts there are with people, the more there is a risk of acquiring COVID, and the less likely you are to get care for it if you're sick. Last, it is true that people who are African American or Latino have higher rates of obesity, heart disease, diabetes, many common chronic diseases, high blood pressure. But it would be wrong to consider these innate. These also are conditions that are driven by the context in which people live. The high cost of high quality food, the presence of food deserts in many poor communities of color, the difficulty in having a life that includes exercise when you commute 2 hours in each direction to a low-wage job. All of these are the circumstances that have created a nation where 80% of adults have a chronic disease. So it's not just people of color, although people of color have, that's how racism works, that people of color have been disproportionately channeled into low-wage, precarious jobs, segregated, low-quality, crowded housing, and with access to under-resourced healthcare facilities. So the good news is that this all can be changed. And of course, we can't take away somebody's obesity in a couple of weeks, but we can work to protect essential workers. And that, I think, should be a focus for all of us, that essential workers have to have paid sick leave so that they don't go to work and create a risk for themselves and their coworkers and the people who they encounter while they travel to work. They have to have access to testing and health care coverage for any form of illness that they have. They should be given incentive pay to ask people to potentially risk their lives because they are deemed an essential worker but are paid below a living wage. It really is unreasonable. And before I have a feeling I should wrap up by now, but so there is a need to protect essential workers, and of course these workers are working to protect themselves, and there are a growing number of wildcat strikes among Amazon workers and Walmart workers. And I shouldn't wrap up without also mentioning the real risks to people who are incarcerated, who also disproportionately are people of color. There right now, as we speak, are several large outbreaks going on in various prisons and jails around the country. In New York City, Rikers Island has 7-fold higher rates of COVID than the general population. The only solution to this is to rapidly decrease the number of people who are being held in these facilities. No one who is not a risk, a public safety risk, should be incarcerated at this time. and they have to be given supports to live on the outside when they're released. Additionally, ICE facilities and immigration detention facilities are in other high-risk situations. So these are not behaviorally driven differences. These are not differences related to defiant behavior by communities of color or who are refusing to follow public health advice. These are not related to ignorance. These are structured into the conditions of people's lives. When people work precarious low-wage jobs, they can't protect themselves from COVID because they have to work in order to live. And that's what's driving the disparities and that we're witnessing for people of color, for people who are Black, Latino, and we can't leave out the Native American population. So I didn't keep an eye on the clock. I don't know who I should turn over to, but I hope that I've made clear that one of the most common explanations for why we see these disparities is that that people have behaved irresponsibly, or that there's something wrong with their bodies, instead of considering the fact that there's something very wrong with our society. If anything, this global pandemic has shown up the many ways in which social failures had made the United States, the richest country in the world, extremely vulnerable to what's become the worst outbreak of COVID so far.
Thank you so much, Dr. Bassett. That was, your sage wisdom and recommendations, I think, and, to really kind of frame the conversation about, concretely the things that we can do and ought to be doing to push back against these challenges that our communities are facing is so deeply appreciated. The chat box is filling up with really important questions. I want to remind people, first of all, just thank so many of you that are attending. First, we should say that at this point we have 262 people who are joining us,
okay,
which is
great.
is a gift, and we're appreciative of that. We want to remind people to please use the Q&A tab or box or button on your screen if you have access, if you've got the ability to do that, because that's where we're going to try to consolidate the questions. But there's a lot of great ones that have shown up on the chat, and I'm hopeful that as we make our way through this presentation, we'll get a chance to try to get some of those questions answered. But for right now, I wanted to express my great pleasure at introducing a couple of special guests direct from Cuba. Our intent was to have with us here live. We worked on this for a couple of days and things were working well until they weren't. And certainly part of that is it's the weather, it's the blockade. It's made it increasingly difficult up until the last minute to have with us on the line both our brother Fernando Gonzalez-Yort, who is the president of the Cuban Institute for Friendship with the Peoples, ECAP, and of course is a Cuban hero, one of the Cuban Fives, members of the Cuban Five, as well as our dear sister Sandra Ramirez, who is the director of the North American division of ECAP. So we pushed and worked. Cheryl Labash, who many of you know and is working behind the scenes, and I were trying to pull that together along with our sister Rosemary Mealy, but weren't able to. But we do have the next best thing, and that would be a video recording. And so I'm going to ask you all to be patient with me as I try to share with you first the video message from our brother Fernando Gonzalez-Yort, and then that will be followed by a message from Sandra Ramirez. So bear with me while I try to do this. This is why we have technicians who can handle this kind of thing faster than I can.
Good evening, dear friends. On behalf of the Cuban Institute of Friendship with the Peoples, and on behalf also of the Cuban Five, I would like to convey greetings to all of you and my deep appreciation. Good evening, dear friends. Good evening, dear friends. On behalf of the Cuban Institute of Friendship with the Peoples, and on behalf also of the Cuban Five, I would like to convey greetings to all of you and my deep appreciation for the solidarity work that you're carrying out to support the Cuban Revolution. We know how difficult this task is right now. Heartfelt condolences to you that mourn the loss of so many US citizens. On these sad days and times, all our sympathies are with you. The virus doesn't distinguish the rich from the poor. Its devastating effects have multiplied throughout the US, but especially in those areas where the most vulnerable and lowest income people live. As you know, Cuba has been combating the deadly coronavirus within the island, but also provided medical aid to other latitudes with equipped medical teams in more than 20 countries right now. However, we shouldn't forget these efforts are done despite the criminal and unfair economic, commercial, and financial blockade the US government continues to reinforce and tighten towards our sovereign nation. We're making great efforts to combat the virus. As of today, 1,460 cases have been diagnosed positive out of 45,344 test results. So far, 617 people have recovered, and unfortunately, the total number of deceased so far is 58. We hope the number of recovered will continue increasing in the coming days. Special measures are being taken by the government to provide extra care to children and the elderly. Although those who are part of the medical teams in Cuba and abroad are risking their own lives to save all the citizens, the Trump's administration attacks against Cuba's system to countries that have requested cooperation are ongoing. By doing this, the US government is seeking to deprive millions of people from the universal human right to healthcare. The magnitude of the current crisis encourages us to practice solidarity despite political differences. The virus knows no boundaries or ideologies. Rather than hindering Cuba's humanitarian contributions in fighting the virus around the world, Washington should be actively supporting it. The immediate way to do so is to suspend US sanctions that severely compromise Cuba's efforts to safeguard its citizens at home, as well as bring medical services to so many others abroad. This hostile policy has escalated, and the almost 6 decades old blockade continues to hamper our ability to export and import needed materials, and has penalized foreign shipping companies ferrying cargo from other countries to Cuba, impeding the flow of foodstuffs, medical materials, face masks, ventilators, test kits, and gloves. It also blocks or delayed donations. Even before the coronavirus crisis, the Cuban economy suffered many such shortages. That's why our people manufactured cloth face masks at home to mitigate the spread of the virus, and they even donate some of them to our healthcare personnel at hospitals and clinics. For those reasons, the sanction suspension movement is now underway, supported by hundreds of thousands of solidarity groups and people around the world. Cuban Americans are also urging Trump administration to lift all restrictions and to ensure that our nation can obtain needed medical equipment, food, and other supplies. It's time to mobilize all friends of Cuba to continue demanding the lifting of the blockade and all coercive measures that damage our economy and our people. Never as today the inhuman nature of the economic blockade has been so evident. We count on your support on this battle. Cuba will continue helping countries in need with the best resources we have, our healthcare personnel. As our President Diaz-Canel said, we will live and we will overcome. Thank you very much.
Well, we were grateful to get that really inspiring, I think, important message from our brother Fernando. We look forward to being able to be with him and all of our friends in Cuba again very soon. And I think Cheryl Labash is going to share Sandra's message.
Dear friend, good evening. Good to know that some friends of Cuba in the United States have connected to this webinar. Thank you so much for all your support, even during this period that forced us to stay at homes. And despite that, all of you are still in solidarity with Cuba. As you know, we are facing a battle against this coronavirus that affected all people all over the world. And in the middle of this effort in our country, we have the Cuban medical students from all the different faculties all over the island. And I want to acknowledge that in this effort and in this contribution, we also have some of the students of the U.S. LAN contingent, the group of United States of the Latin American Medicine School that have decided to be side by side with the Cuban people in this battle against the coronavirus. They go door to door asking about symptoms, looking for pre-existing condition, knowing about how many elderly people are there living in those communities, about children, about the contacts with travelers, or with someone that have been abroad. And since the beginning, since the appearance, the presence of this virus, those students have been working hard with health personnel, not only from United States, but also from other countries, because as you know, this Latin American Medicine School was founded in 1998 when the Mitch hurricane hit some Central American countries. And as the time passed, more Latin American and Caribbean countries decided to send students from the low income families to go there and study medicine, of course for free, with the only commitment to return to their communities and to return to their communities and to offer the services of health care, especially to those communities that are on the health services. And to us, it's also important that are part of our community or our community effort to eliminate this virus. This school is also a great inspiration to all the world. And to me especially, it has a special significance because the majority of the US students that are participating in this battle, they study at the Enrique Cabrera faculty that is just placed in the community where I live. So daily I have the opportunity to meet them either in the store, at the agricultural market, at the polyclinic, and at the same time there are ICAP official or a person working at the Cuban Institute of Friendship with the People. I also have had the possibility to receive direct attention at the hospital from a US alum student. In this case, I'm talking about Samira, that she's 6 years alum student, and she managed to give a primary healthcare attention to me when I suffered in November from dengue. So this school helped to provide human resources to all the country in Latin America, in the Caribbean, in Africa, but also in the United States, in those areas that have problems with the health care attention. So it's also a proud to us that are working directly with these students to give attention and to offer an institution as a house, as a home, as a family where they can come and get in contact. So I want to acknowledge also the work of IFCO in the selection of this student in US, these young people that are such a good, that's such an excellent student, and they can, they're good students that have come here and study very hard to be one of the best students regarding qualifications, regarding their marks at the school. So I would like to ask all of you to spread the word about this beautiful work of the IFCO Pastor for Peace in recruiting students and young people on those areas, on those communities that have problems with the health services, to send them here to Cuba to study medicine for free, with a commitment to return there and help them to offer these services to those people that are in need, that they don't have incomes to pay not only their study, but also their services. Thank you so much for being content. We are trying to do our best to continue participating in this effort that you are doing on the networks, social networks, on internet, to make the people know about the truth of Cuba, and also about the work that we are doing to try to eliminate this virus not only here, but also in other countries. And in that effort, we want also to acknowledge the work of a U.S. student. Thank you so much.
And thank you, Sandra, for your wonderful, warm greeting to us. Thank you so much, our technical people, for allowing us to get that direct information from Cuba. And now I would like to introduce another member of the IFCO family, Dr. Mary Louise Patterson. Dr. Patterson is currently a semi-retired pediatrician on clinical staff at the Will Cornell Medical College in New York City. She was born in Chicago. She grew up in Brooklyn, and she earned her medical degree at the Patrice Lumumba Friendship University in Moscow, formerly the Union of Soviet Russia. And she has a master's degree in public health from the University of California. Besides practicing medicine, and I said that she was a member of our IFCO family, she has been active in encouraging children in underserved minority communities to be curious, wanting to learn and pursue science. And she has participated and continues to participate in numerous civil rights, social justice, and peace movements. Mary Louise is a member of the IFCO Pastors for Peace Medical Committee for the Latin American School, ELAM, which selects US students to study medicine on full scholarship in Cuba, as our prior guest explained. Welcome, Mary Louise.
Thank you very much, Rosemary. I am happy to be a part of, and honored to be a part of this webinar. I would like to introduce our next speaker, who is Dr. Melissa Barber. She actually wears many hats. She coordinates the IFCO Alum Medical School Scholarship Program, helping to recruit young people from the United States to take advantage of Cuba's generous offer to study medicine under full scholarship, with the only commitment being to return to practice in the medically underserved communities from which they came. A graduate of the LAM herself, Dr. Barber also puts her training and commitment of community organizing into practice in the South Bronx, New York, where she lives. It's an economically and racially depressed area with an exaggerated number of coronavirus deaths. She is on the front lines there fighting coronavirus today. She is a mother of a child with autism and is a staunch advocate for parents of children with autism. She also works with various community programs, including South Bronx Unite, a coalition of South Bronx residents, organizations, and other allies working together to improve and protect the social, environmental, and economic future of the South Bronx, and with Radical Health, which works to address social determinants of health for underserved populations. She is also a beautiful human being whose life is a positive example. Dr. Barber, take it away.
Hi, good evening, everybody. This is Dr. Barber. Thank you for that warm welcome, Dr. Patterson. I wanted to talk a little bit tonight just about my work and what I'm doing here in the South Bronx, but I also wanted to relate that to my training in Cuba. So for many of you who are or are not familiar with Cuba and knows the healthcare system there, you know that there is such an intersection or intertwining of medicine and public health, which I think is very important. In the United States, we have a real divorce of those two entities. And if you understand just how vital the two are together, you understand that they can never be separated. And I think that with my training, there were 7 things in Cuba that were very important in learning. So the first thing was the idea or the concept of healthcare being a human right, right? That being something put into the Constitution, that being something told to its citizens from the very time that they were born, that healthcare, just like education, is a human right. And for many of us who are here in the United States, we know that it is not the case. As Dr. Bassett mentioned, there's so many of us here in the United States who do not have access to healthcare. No matter how hard we work, no matter how hard we try, the idea of getting healthcare is such a foreign concept to many of us because the cost of it is so prohibitive. Sometimes we are in the category of those essential workers or, workers that don't really have access to getting healthcare. And so when we look at healthcare as a right, it really puts a different perspective on things for people, because if you know that no matter what happens, there's a system in place that not only can prevent something from happening to you, but take care of you if something happens to you, there's a very different way in which you can go about your life, right? You know that there's access. You know that if I have this headache, if I have symptoms, if I have whatever I, have, whether it's a fever, whether it's, in the case of this COVID-19, a fever, shortness of breath, there's, a cough or a loss of, sensations, there's somebody that you can reach out to immediately to seek help. And for this particular situation, that has not always been the case. In communities like mine in the South Bronx, you have many people here who don't have access to healthcare. You don't have the availability for them to walk into an emergency room and get seen because they don't have access to healthcare. So you see that there's such a disparity in how it, this virus, this pandemic is playing out in communities throughout the United States, because there's so many communities that are inundated with people of color who do not have access, right? Who do not have an outlet or somebody to talk to if, and in the event that they have, symptoms of COVID, right? Particularly here in the South Bronx community, you also have the lack of testing sites. So if you see, in New York City, when this pandemic began to play out here, they said, okay, let's open up, these 10, hospitals in Jacob Javits Center. Let's open up these places where people can come to get this testing or to be seen, because they didn't have enough room in the hospital settings. But in many communities like the South Bronx, the hospitals were so inundated that they could not accept any patients. They did not have testing for COVID. Now they're starting to have access to COVID, but you need a card to get to so many of those places to actually get access. And then they have all these rules and regulations as to who can get tested for COVID or not. And again, if you don't have access to healthcare, you don't get a test because they're billing your insurance, right? So there's so many factors that come into play that exacerbate this virus, the spread of this virus in so many communities. And so I just wanted to talk about that specifically because if you have a system in place like Cuba, where you have access to doctors around the clock, you have access to students that are doing pesquisa, and pesquisa, what it is a screening where they're going and knocking on doors every single day to actually make sure that nobody is falling from the cracks and that there are people, you know, making sure, like when they knock on the door, do you have fever? Do you have all of these COVID symptoms? Do you have pre-existing conditions? Are there particular needs that you have that need to be met? You can get a hold of or get a hold on, you know, this disease spreading or this virus spreading to other people in the populations, but you can also stop it in its tracks from, really affecting the community in a way that it would, you know, affect them if there was no regulations or no systems in place. And so I say that just to, you know, give you a background of some of the things that are not happening here in the South Bronx, or many urban communities throughout the United States. You have people who, because of this situation, don't have access here in the South Bronx to medical care. You don't have people actually checking on people to see, you know, what's happening. And I think that for me, particularly with my skill set, when you are taught, you know, the basic idea, the basic premise of screening mechanisms, when you're taught that you are your brother's keeper, one of the first things that I said to myself is like, you know, I need to get a hold of like the tenants association in my building. We need to figure out who vulnerable populations are here. We need to figure out how to assess the health of our community so that when we do that, we know and we can keep an eye on people who really need help. You know, who are the people that have these pre-existing conditions that will expose them? How do we get help to the people that need help? You know, who are the families that are out of work? Who are the families that are, you know, dealing with quarantine? Do they have the necessary information that they need to maintain themselves in quarantine? Do they have the necessary medications within their households to actually maintain themselves during this period of time? And I think just being proactive in that way has really helped my community in connecting people to the resources that they need. I found that being here in this community, I saw that many of our elected officials, you know, it's voting time, it's voting season. So a lot of people are out there and they're making their presence known. And it's like, how are you making your presence known to be effective to help the community at large at this particular time? And I didn't really see anybody doing screening, doing surveys for this community. Nobody really saying, okay, how do we open up testing sites here in this community so that people have access to COVID? When we talk about pre-existing conditions, yeah, people have pre-existing conditions, but they also have environmental conditions that don't necessarily make it conducive for them to be well in a situation like this. You know, when the mayor and the governor decided to shut down the city, you know, they weren't realizing that, you know, in communities like the South Bronx, you have an oversaturation of NYCHA housing. Most NYCHA housing is inundated with asbestos, inundated, you know, with mold, inundated with lead, inundated with so many toxic and poisons within that structure. When you confine families to that, you're exposing their lungs to a level of pollution and environmental pollution that also make these conditions, you know, pre-existing conditions exacerbated in that time. So, you know, whereas, you know, you're looking at a spread of a disease and you're saying, oh, you know, these people that have these pre-existing conditions are a little bit more susceptible to a virus like COVID, you're not thinking about the fact that you're sending people to housing conditions that literally expose them to a virus, right? You're not even thinking about how can we set things up in place so that these people who are living on top of each other and who are in crowded spaces where social distancing is going to be almost impossible, how do we actually work with this community so that we don't have a rampant spread of this virus throughout these buildings, throughout these major complexes, throughout this community? And I think all of these things were forgotten about when they began to think about just what they were doing. And so together with many of, the Coalition South Orange Unite that I work with, we've been connecting families with food resources. We've been connecting them to get HRA benefits and SNAP benefits. We've been connecting them to get the resources that they need, as many people are out of work here, especially those people who have contacted the COVID virus and have, multiple children in their home and no one is working and everybody has to be self-contained. We've been doing a little bit of the pesquisa on a very small scale. I just was able to connect with another Elon grad, and we're putting a proposal together so that we can do full-on pesquisa within my building complex, so that we have over 700 families actually being surveyed to make sure that people who may have been diagnosed with COVID have the necessary resources that they need, or just other resources that may be possible at this particular time. So I think that, in terms of what we're doing here should definitely be models for other people in other communities, especially for Elon grass, so that we can really full scale make sure that nobody is falling through the
Melissa, I don't know if you can hear me. It seems that it's a little bit, your sound is a bit muffled, and we're trying to decipher because there's a lot of important information. But right now, your mic is muted.
Can you hear me now?
Yes. Yes.
Oh wow. When did you stop hearing me?
I think you were going. I mean, there have been a lot of comments in the chat about people not being able to hear. We just explained that you were having some challenges with the computer, and that you're trying. We felt that the information was important to share, but you should know that it's that it's a little challenging for some people to really grasp all of what you're able to say. I think your mic just cut off, or you just went to mute just now. So perhaps what we can do is try to get some of what you're saying typed up, and we might be able to share it with people after the webinar, for those who weren't able to decipher what you were saying.
Okay. I'm sorry about that. Can you hear me now? Is it okay, or is it still muffled?
I would say, why don't you go ahead and continue, and we'll do what we just said. We'll also try to type something else, up, maybe based on the recording. But why don't you go ahead and, because it looked like you were probably heading toward a conclusion.
Yeah, I actually was saying that in conclusion, if you didn't hear me, I'll definitely make sure I type stuff up for the information. But I also now wanted to introduce a video so that many of you can actually see how in Cuba, we actually, as a nation, would do surveying of families and communities. So if you can just sit tight and hold on, we'll be playing a video right now for you to actually see our students, our ELAM students in action.
doctors, from medical students, other healthcare workers, and approach in the fight against COVID-19 starts off first and foremost with an emphasis on prevention, and that's preventing the virus from entering the country, and then preventing the virus from entering certain neighborhoods. And areas where there are positive cases of COVID-19, the goal is to contain the virus. And all of this is done with the participation of sectors from every aspect of life, from doctors, from medical students, other healthcare workers, and more importantly, members of the community.
Ways Cuba's approach to fighting COVID-19 is a proactive one, which makes sense because the healthcare system is founded upon preventive medicine. When the pandemic really started to take shape, Cuba did a great job of preparing their citizens on what to expect from the coronavirus, what are the signs and symptoms, what do you do in the event that you get these signs and symptoms, you know, who is the at-risk population.
The Cuban system is vigilant in that medical professionals actively look for cases rather than waiting for patients to come to them. In Cuba, the pesquisaje is used as one of the first lines of defense in prevention. Cuban medical professionals visit all the houses in their assigned communities in order to check up on their community members. It is used as a tool in order to prevent and control the spread of certain diseases, as well as a tool to collect biostatistical data.
We go into the communities, to people's homes, to see how is their home environment, how is their house, how is the community itself and the hygiene of the community, as well as other issues.
It's really important to identify potential cases in the community. That's the main objective of the pesquisa, but it's also a great way to remind the community about preventative measures and actions to take to fight COVID-19. We come here to the communities, we talk to upwards of 50 patients a day in their households, and we ask them who lives there, if there are any patients that are showing symptoms, if there's any patients that are over 60, which is considered a risk factor, and therefore we add those numbers up and then we give them to the professor to then tabulate all this information and have it available for the people in the polyclinic to follow up on.
For me, I've been going to the same neighborhood, the same block, for maybe more than a month. So around now, I know the names and faces of like 60 plus homes, and they also know my face. But I don't go the next day to ask me where have I been. For me, that's what community health looks like. Is where you get to know your patients.
Before now, we have done pesquisa yearly for dengue during its peak times. I feel as though during pesquisa is my way of contributing to assist in saving lives as a future doctor in training.
When the first case was discovered later on in March, Cuba readily made available the resources necessary to isolate and treat confirmed cases, recognize and quarantine suspected individuals, and conduct tests to diagnose or rule out suspected cases. The preventative measures have been active and not passive. That is because the cases are sought out. Within communities with confirmed cases, there are mass screenings and testings conducted.
When you get tested, if your test comes back positive, you are going directly to the hospital, you are ingressed, and you are going to a specific hospital attending to all COVID-19 patients.
A couple of differences between the Cuban approach and the American approach to fighting COVID-19 is one that Cuba has a central and universal healthcare system, whereas in the United States of America, we do not have a universal healthcare system, or we do not have a healthcare system at all. And one of the advantages to that is that everybody on this island gets care, irrespective of income, race, et cetera, or any other determining factors. If you are symptomatic, that is known to be a risk for the entire country, and therefore you receive treatment. So what you are hearing right now is the applause that every night at 9 p.m., even people everywhere, all across the country, go out on their balconies or windows and show their appreciation for all the healthcare workers in the country who are really sacrificing and putting themselves and their families at risk to try to eradicate this virus on the island.
Cuba has shown its solidarity with the world by sending its physicians abroad to aid in the fight of this pandemic. Some of the countries that have benefited from this aid are China, Italy, Jamaica, Togo, Mexico, amongst many. Even the UK benefited from Cuba's aid when it accepted to receive and treat infected UK citizens.
Elon teaches you to be ready for anything, and Elon teaches you to go where you're sent, to go where the crisis is, to go where the need is.
It has also stressed the importance of having a plan, having preventative measures, and also the importance of having collaborators, both domestic and international. In this case, it is one world, one fight.
It is amazing to be a part of a nation right now that has a human-centered approach, not because it's new to this pandemic situation, but because that is the structure of the Cuban healthcare system, to value people, to value humans, and it's not a business.
This really puts places into perspective the importance of having a system in place for when the next crisis hits.
It's an honor to live and learn in this system. I hope our communities back home will learn from this example and actively seek out the health of present and future generations. And it is clear that as COVID-19 respects no color or creed, our health system and society in general must learn to value all human life, regardless of color.
Well, thank you so much for putting that wonderful video montage together. This is Dr. Rosemary Mealy again. And, you know, I think what we're beginning to see here quickly before I introduce the next guest is when I started out talking this afternoon, I talked about alternative systems, and we've heard from Dr. Bassett and all of the guests prior to this who've laid out the realities of what's happening in the United States. And what we're attempting to do here is to show that there is another way, there is another model. And I think that's been reflected in what you've heard from the students, from what Dr. Barbara is saying, who's attempted to take the model that she learned at Elam and bring it into the Bronx. And, excuse me, on that level, from that perspective, we're now going to introduce Dr. Sitton Sales, another graduate of Elam from 2010 from the Latin American School of Medicine. She did her residency, by the way, at New York's Wyckoff Health Center, and she provides services to workers of the Service Employees International Union. Dr. Sitton Sales, please kind of share your experiences with our viewers.
Okay, first of all, thank you so much for that introduction. Before I start, I would like to give condolences to all those that have lost their lives to coronavirus and to all those who are currently in hospitals and in communities struggling to stay alive. I also would like to give a congrats and thank you to Dr. Melissa Barber for the great work that you're doing in the Bronx and all the Elam grads and the Elam students that are out there on the front lines. First and foremost, we are all on the front lines. This is not just the healthcare workers. We are all on the front lines in some sort of capacity against this virus because it is affecting all of us. Currently, I am working in a multi-specialty healthcare center, Union Health Center. We have a total of 18,000 patients, and we have about 13 healthcare providers. That includes doctors, physicians, assistants, and nurse practitioners. Most of the members of most of the patients that we see are members of the 32 Buildings and Janitorials Union. So most of them are essential workers. They are the doormans, the porters, the laundry workers that maintain this city. They still have to work. I'm currently working on the front lines, but in a different capacity. I do not work in the hospital. I work in this clinic. For the past month, we've converted a lot of our visits into telephone visits. And we do still go into the clinic, but in a smaller capacity. We're only open now 3 days a week, and the rest of our visits are over the phones to try to maintain contact with our patients. We're hoping that in the next 2 weeks that we'll be fully operational again. While triaging patients on the phone, I've had to be very creative with the kind of care. I've had to depend a lot on listening to certain cues, listening to how they're breathing, if they're breathing very fast, if they're coughing, trying to listen out to see if there's phlegm, speaking to family members, and really monitoring their symptoms more so based on what I'm hearing, and I'm not really able to see them. A lot of our people have lost faith in the medical system, and they're very scared to go to hospitals. So a lot of times I have people that call me and they're very, very sick, and I have to administer care. The only thing they tell me is, I will go to the pharmacy, but I will not go to the hospital. And sometimes I just cannot convince them to go. Cuba prepared me in many ways for this pandemic. The first thing is that Cuba has always stressed primary care and preventative care. Cuba has always felt that in the middle of any type of epidemic, the primary needs of the people needs to be addressed. What does that mean? Just because coronavirus is around, there are people that are still suffering from high blood pressure and diabetes. Their illnesses and chronic conditions need to be managed. And we as primary care physicians need to make sure that they still have access to their medications, they still have access to doctor visits, and they still are being taken care of. Because yes, while this disease affects many with chronic conditions, it affects people worse if their conditions are not controlled. So that's very important to understand. Another thing that Cuba taught is anyone that studied in Cuba worked through the dengue epidemic. And a lot of the things that I saw in the video with a lot of my, fellow comrades and Elam students was going out, doing home visits, going out to people. That's something that's always been in the tradition of Cuba, that they've always done outreach to the community. If you can't bring people in, you have to go out and you have to engage them. That's very, very important. So I think we as a society need to really think about implementing home visits and getting out to people and really examining them while they're in their homes, because when you see the conditions that people live in, you sometimes have to tailor your plans of care accordingly. Another thing that Cuba taught during epidemics that I think we could really learn from is education. Education. If you go to Cuba during the dengue epidemic, there are posters everywhere explaining what is dengue, what is the mosquito that can transmit it, how to prevent yourself from catching it. You have commercials, you have posters, and they're actively engaging the community to learn about it. There needs to be more education and more ads and things around coronavirus and what it is and how it can affect you and how you need to protect your household, and people have to have more access to this. Also, I'm sorry, I just have my notes, excuse me. Okay. Another thing that I also wanted to mention is that one of the things I've been trying to stress to a lot of my patients, this is the time to be extra healthy, to eat right. If you smoke, stop smoking. You are in a position to stop smoking because if you're at home and you're quarantined, you actually don't have the stress of going to work. For some patients that don't, for other that are essential workers. But you have the possibility to stop that bad habit. You're in an environment now where you can. So stop drinking, stop smoking, increase vegetable intake. Right now, all the fruit stands and vegetable stands are still fully operational in New York City, and they're selling fruits and veggies very cheap. Just make sure you wash them off. That's very important. Exercise and try to take vitamins. Those are very important things. They have some certain resources for patients that are requesting mental health needs. The city has a hotline, and there's also another website, blacktherapycentral.com, where you can get information. A lot of things right now in the hospital level, I've been in contact with a lot of my colleagues, and it's very sad what is happening to them. There's not enough staff. There's not enough resources. There's not enough staff. There's not enough resources. People are being overworked. People are severely traumatized and experiencing burnout as far as healthcare workers. And people are being turned away from hospitals. But these issues are not new. These issues have been going on in hospitals that you find in poor areas in New York City, where a majority of Black and Latinos live. This is not new. And the thing about it is these are issues that have been going on for a while that we have to address. And just because coronavirus is around, we still gotta bring up racism. We still gotta bring up white supremacy. We still gotta bring up inequalities. And more than now, we need to bring it up, even more than before. The next thing that I wanted to talk about is what can we do? What can we do? What can we do? What can we do? The first thing is that I think what Dr. Melissa Barber was doing was exceptional work. We need to take back our communities. We need to honor home visits. We need to make sure that everyone gets their vital signs checked in the community so that we can pinpoint people that may be affected at an earlier point in time and have a better chance of getting them treatment before it gets to a point where it's really bad. These are things that are cheap, and these are things that can be done not just by doctors. Anyone can be taught how to take blood pressure. Anyone can be taught how to get a pulse oximeter, put it on someone's finger, and read the settings. And anyone can be taught how to weigh somebody on a scale. That doesn't have to be just a healthcare worker. And in the tradition of Cuba, Cuba has always been in the tradition of teaching. If you don't know, well, you're going to find out. If we don't have social workers, we're going to go to this high school and we're going to train them how to be social workers. We don't have doctors, we're going to train them. So the thing about it is we have to bring the power back into the community and let them know that we can teach ourselves how to do these things. And if we don't have enough tools, oh, well, somebody can sit in the lobby, somebody can be offered protective gear, and one by one, different tenants in buildings can be checked and vital signs can be taken. And when it's time to go to the hospital, they have advocates that say, this person is in need, we check their vitals, we have this information, you're gonna go see them. You're gonna take this patient. So those kind of things need to happen. Another thing, testing needs to happen for everyone, not just people that have symptoms. It needs to be everyone, because what scares me the most are the asymptomatic carriers. That scares me the most. And I think testing needs to be provided for everyone, because there's been studies done. When patients hear that they have a positive test, they respond differently. That's just what it is. People have to see it, they have to know it, they have to know this is positive. And plus, it'll address a lot of things and let people know we need more resources. You know, by not testing it, it can still say, oh, it's, you know, we need more resources. The next thing is that we need to discuss that more doctors worldwide need to be in communication. You know, the blockade needs to end. Cuban doctors need to be here on foot. Chinese doctors need to be here. China's been dealing with this problem. There's wonderful research that China has done, wonderful research that Cuba has done. They need to sit at the table and they need to be discussing things with scientists. This is how we're gonna, and this is how we're gonna get past this issue. So that's very important. The next thing is we need to bring the discussion to the table that all of the Elam graduates, they need to be offered residency positions in all these hospitals. Because in my heart, if there's anybody that's trained to handle this problem, it's us. We were born and bred to do it. We did it for 6 years, some of us 7, and we know how to handle this. So we really, really, really need to put the full court press. And right now, more than ever, more residency positions need to be offered, and we need to get more of our people in there, and this is the time to have that talk. So that is very important. The next is, a lot of our people are not living in conditions where they're able to socially distance, and they need to be provided with some level of housing that can allow them to practice safe social distancing, which a lot of them are not even able to do because, you know, if you live in New York City, usually you live one on top of the other. But I'm very confident that we will, we're still not in the middle of this thing, and it's very sad what's going on. But I think we can do this, but we gotta be creative. We cannot look to people that we are hoping that are gonna do for us and expect. We have to take it into our own hands. And I really applaud Dr. Barber, and I really applaud everybody that's doing it. And if anyone wants to talk to me, please call me, because I really feel like outreach, home visits, taking vital signs, you know, making sure people are taking their medications for their chronic conditions, simple things like making sure that, you know, people know how to clean their homes appropriately and that are educated appropriately. These kind of things are very important. So, you know, once again, thank you to IFCO for all the work you've done. You all are on the front lines. Thank you to everyone that's a part of this panel. Thank you for inviting me. And I hope that we continue. I hope that we continue this discussion and that we continue meeting. It's so important.
I am just in awe of you, Dr. Sales. That was so inspiring, so powerful. Both you and Melissa Barber. I want to read something from Catherine Murphy in the chat. Dr. Sitin Bailey Sales and Dr. Melissa Barber are beautiful, powerful, living proof of what social justice medical practitioners can be. Thank you both, and thank you, Cuba. Couldn't say it better. That was just, both of you really, I think, helped to hone in on what it is that we ought to be about, and really bringing knowledge about the training. The training that only those of you who have actually attended ELAM and been trained in Cuba can bring to the table. So thank you both for doing that. I know we're running a little over, but this is really important information. So I hope that as many of you as possible can hold on, because we do want to try to address some of the questions as best possible. Next, we have up is a dear friend, another family member of IFCO. She is a longtime community activist in the Haitian community. Ninaj Raoul is the executive director of Haitian Women for Haitian Refugees, one of the groups that within the Haitian community that IFCO has partnered with throughout the years through our fiscal sponsorship program. Ninaj will be speaking on the work of Haitian Women for Haitian Refugees, and specifically relative to the impact of the pandemic on the community that she serves, and some of the other work that's affiliated with that particular work. So Ninaj Raoul, please, it's over to you.
Thank you, Gail. I'm gonna jump straight into what's going on here in the Haitian community. I know that the arrival of the pandemic has had a host of unprecedented impacts on communities throughout the world, and throughout this country, and certainly in New York, where we are over here, as it is the epicenter right now. But I'm going to speak more about the immigrant communities, Black immigrant communities in particular, the Haitian community, and the impact that it has had on immigrants, not just immigrants in general, but what we've done at Haitian Women for Haitian Refugees. We've shifted our focus since the pandemic on what we believe are the most vulnerable amongst the immigrants, are the undocumented immigrants in our population. And we typically work with 4 groups of undocumented immigrants. One group are TPS holders that have temporary protective status. They have, as many of you may have heard, the Trump administration has decided to terminate their status in 2017. And the only reason that they still have some status is because of several litigations that have been brought up against the Trump administration. Haitian Women for Haitian Refugees is actually a plaintiff in one of the litigations with the NAACP, Legal Defense Fund as our legal defense. And there are several others that have been heard actually that are keeping people in status temporarily, but that can end at any time because we're waiting to hear from a judge's decision. So people are really anxious about that because they could, we're talking about over 50,000 Haitians that could lose their status any day now, and a total of over 300,000 immigrants in general, people of color, that can lose their status at any day. It's the same situation for the folks that have DACA. There's over 800,000, they can lose their status any day. The second group that we work with are folks that are domestic violence survivors, women who are domestic violence survivors that are applying for VAWA, Violence Against Women Act, or U visas, where you're, that's for a partner who wasn't married to their offender, that can apply for a green card because they're victim of a violent, or survivor of a violent crime. So we have a support group we typically have a support group that meets regularly, but because of the pandemic, we haven't been meeting in recent weeks, and we're going to start to resume those meetings and just do it via video conferencing. And the third group is people that that are under 21. These are youth that are applying for something called Special Immigrant Juvenile Status. And this is for people under 21 that are undocumented, found themselves in the US alone without a parent. And they also qualify for applying for permanent residency. But we're working with a group of them, and we also have a CIGIS committee, which is made up of at least 10 members of CIG applicants, and they hold their own support group as well. And the final group of undocumented folks that we are focusing on are the Haitians that crossed the southern border in recent months and the past year as well. People that mostly came from Brazil and Chile. Most recently, we've had Haitians coming from Chile. These are people that have been living there for years since the earthquake of 2010. They traveled there to work, and tens of thousands of them have taken a treacherous route through Central America and come up through Mexico and cross the border, the southern border of the United States. And these folks are, most of them upon entry, they're made to wear ankle bracelet, electronic monitors, and then they have to check in with immigration regularly. So I can't begin to tell you the level of anxiety that these folks are living with right now. I mean, we all are living with a level of anxiety because of the fear of getting sick and dying. But in addition to that, they have to deal with the fear of being picked up by immigration. and so they're afraid to go out for that. In recent weeks, starting just 3 weeks ago, they resumed deportations to Haiti. ICE resumed deportations to Haiti. Even though Haiti doesn't have commercial traffic coming in, they sent chartered planes. And the first group of people that they sent from Louisiana detention to Haiti is a group of just over 60 detainees that had been detained in an ICE facility and exposed to COVID positive detention employees before they decided to send them to Haiti. So that first group that was sent to Haiti, the Haitian government tested them upon arrival, and 3 of them tested positive. And just last Thursday, they decided to send another 112 Haitians back to Haiti through deportation. So that alone, hearing that, the folks that we're working with in the community, that has really intensified their level of fear. And people are really afraid to go out, just even to get food. And then we have the fact that immigration has stopped a lot of their services. So people that had appointments to go before judges, to go and check in, the people that are being monitored, the intense surveillance program for the folks that have ankle monitors, they're supposed to check in regularly. They can't go to their appointments, and they're very anxious about it. So these things, I don't know if anyone's familiar with these ankle monitors, but basically it's like having a cell phone that you have to take out the battery and charge it and constantly keep it charged, or else they're going to accuse you of tampering with it. So, so they're dealing with that. So they're stuck with these ankle monitors for Lord knows for how much time. And and wondering if their cases are being closed, administratively closed, if they're going to be ordered deported. And that, coupled with the fear that they've seen people being deported to Haiti, is really crazy, raising the fear inside them. And basically what we've been doing is working with some of community mutual aids. That's a good thing that's been happening is here in the Black community, there are mutual aids that have developed where people have come together and volunteers and organizations. We're partnering with one in particular that a few organizations got together, one called Decrim and Black Youth Power 100 and Black Alliance for Just Immigration. They have a Central Brooklyn mutual aid, and they reached out to us immediately when they put it together to see if they can help by delivering groceries and much needed items to individuals that are afraid to go out. So right away, we focused on this most vulnerable population as we prioritize them. And so they've been getting weekly deliveries from them. And also there's a Crown Heights Mutual Aids that's made up with just concerned individuals, and they've been doing the same. And we have our volunteers that have been going out and delivering things to folks from these 4 populations. And so that's one really good thing is that people are really coming together and working with each other and helping out wherever they can, being conservative community members. Again, earlier, Dr. Bassett mentioned the excess risk of getting exposed to COVID-19 in jails and prisons. And again, because these places are breeding grounds. So that is the situation in the ICE detentions as well. You know, people are crammed into one cell, and you know, it's really unfortunate that this government has decided to start deporting people in the middle of this to a country like Haiti that does not have the infrastructure to even really begin to provide health care for the folks that are already there. And then you're going to take people that have been exposed to, because of your neglect in your facility, that have been exposed to COVID-19 employees, your employees, and then your solution to doing this instead of providing healthcare for them is just put them on a plane and dumping them in Haiti. So that has caused a lot of anxiety amongst the population in Haiti. And deportees typically have to face backlash going back to Haiti, but now imagine if people are gonna think that you're COVID positive and coming back, then you have double backlash headed towards you. So those are some of the issues that we've been dealing with. Fortunately, we've been able to adapt our organizational and programmatic, just change the adaptivity to start doing more remote services. We continue to work with our legal partners and to make sure that the cases are going on. For example, one of the concerns have been the youth cases that have to apply before they turn 21. We have a few cases that are nearing 21 and they have to have guardianship, and they have to go to family court to get that guardianship, and the family court's been closed. So there's been some advocacy done, and now we just learned in recent days that they will be able to do teleconferencing to have some hearings for those guardianships. So there are good things happening as a result of advocacy. But we have quite a ways to go. No, I don't have a lot of time, but I just want to say that you know, we continue to do what we can, as everybody is. People are stepping up. Many of our folks that we work with are also home attendants, that are those essential workers that don't have a choice and can't say, most of our folks that are TPS holders, they're home attendants, and they can't say, no, I'm not gonna go to work anymore. And they have to ride the subways to go to work, and they have to take the buses to go to work, and just stepping on a bus and stepping on the subway, you're afraid that you're gonna get sick right there. We have some of the folks too that are working in nursing home as nurses aides and so forth. So those folks have really been expressing a lot of fear. So that's one thing that we're just dealing with is fear. And we're, you know, again, we're talking about people that generally are afraid to go out. So going to the doctor is not an option. And are just afraid to, like in New York City, the city is providing free meals at a lot of 400 public schools where people can just go, they call them grab and programs, and you can just go get free meals, not just to children, but anybody with no questions asked. And I've been trying to share this information with some of our undocumented folks, and they're like, no way. They're afraid to go out. They're not going out. And that's the level of fear they have. So that's why we've been trying to focus more on this population and trying to deal with some of the food security issues that they have and other just getting general hygiene products and some of the needs to them. I'm going to stop there, and if there are questions going forward, then we can address things. Thank you.
Well, listen, we want to thank all of you. Ninaj, that was, really just, I think, putting a human face on this pandemic and what it means in real terms is so critically important. And, when you talk about, food shortages, something as simple, but that's been a little bit of a theme throughout. It's important. It's important for us to really sort of see the way that our friends and our neighbors are being dramatically impacted by this. But thank you for sharing that. We know that things are running long. This is the moment in the program, being the daughter of a Baptist pastor, that I'm going to be frank and go right to the jugular and say that we're a grassroots organization. We really rely on the support of you, our friends, our donors, our partners, the people that we have partnered with to do this work over all these years. And so we want to ask you to take a look at the screen and look at the 3 different ways that you might donate to help support this work. It's really critically important that we continue to have this connection with you all. We don't get money from the feds. We don't get money from, corporations. We really have literally survived. You've been our lifeline, and we wanted to make sure that we didn't end this evening without providing you with the opportunity. The wonderful, think of it that way, as an opportunity to support this work and to support IFCO and the ongoing various campaigns that we're engaged in.
And Gail, I think we have quite a few new people who have joined us who are not familiar with IFCO. So this is another way that we have something that comes out every week called the IFCO Buzz. And this is where the IFCO Cuba Buzz. And this is one way that you can be connected to the organization and the work that we're doing, not just around Cuba, but all the other projects that we're engaged in. So what we want to do is not jumping in front of you, Gail. We want to, being radio folks, we want you to go to your, click on that button that says donate button, and you can send a check, whatever amount that you may have. You want to make it out to IFCO, you want to mail it to us at the P.O. box that you see on the screen, because we are engaged in a lot of work right now. And we felt that this particular webinar was really important because what it does, it brings home the political analysis. It links you with an alternative, and you don't get this. I mean, I haven't seen this on any of the other webinars, as Dr. Bassett mentioned. And by the way, for those of you, Dr. Bassett's, her mantra is healthcare is a human right. And that's an important piece. So if you feel that an organization such as this should exist and continue with the work that we're doing, then we ask you to look at the screen, and there are, how many, there are 3 ways.
There are 3 different ways. That's right. You can go to the IFCO website, ifconews.org, and there's a donate now button, very similar to the one that is over the shoulder of Dr. Rosemary Mealing right there. You can do it that way. You can go to the good old fashioned, write out a check payable to IFCO and mail it to our P.O. box. We had to set up a P.O. box so that we can receive funds and our mail, because everything is shut down, but Solidarity is not shut down. So please support our work. And then the 3rd way is thanks to our dear, dear friend, Emily Thomas. Many of you know her. She's, can't say enough about how wonderful she is, but she helped us set us up, get us into the current age. You can text to IFCO by dialing that number on the screen, 646-859-5344, and follow the prompts. So there are 3 different ways that you can support us, and we hope that you will do so. as we
And,
continue.
and most importantly, all of your donations are actually tax deductible.
That's
I mean,
right.
you can get a write-off. If you got, hey, you know what? I have a great idea, Gil. Like
What's
a
that?
lot of folks who may be looking at us today, maybe they got their stimulus checks, right?
There
That's
you go.
where Donald
There you
Trump
go.
wanted to put his fixed signature on it. Well, put your signature on it and send it to us.
That's
Half of it, a third of it. We
That's
would have
right.
really appreciated it. So, you know, we are, and there's a little bus down there that many of you see, which is another one of our signature organizations that we don't have too much time to go into it, but we will be discussing our caravan, where once this thing gets to the point where we can travel, you'll hear more about the IFCO Pastors for Peace Caravan, where you can actually go to Cuba with us.
Yes.
So again, text, for you tech savvy folks, those of you who want to write out the checks, you can do that, or you can go to our website and do what, Gail?
Push that donate now button, or pick up your phone and dial that number and text IFCO, and like magic, money will appear in our account. So that's wonderful. Well, listen, thank you. We want to move on. There's a couple of things that we want to do before we open up the opportunity for questions and answers. We've got Dr. Mary Louise Patterson, we're going to ask to come back. As was mentioned, she like many of us, wears many hats, but she is a member, one of the founding members of the Medical Advisory Committee that IFCO works with in order to help facilitate our role to recruit young people to attend ELAM. And so Dr. Mary Louise Patterson is going to come and speak on a little bit about the scholarship program. Dr. Patterson, are you with us still?
I am. Thank you, Gail. When the past WHO Director General, Dr. Margaret Chan, visited ELAM, this is what she said. I know of no other medical school with an admissions policy that gives first priority to candidates who come from poor communities and know firsthand what it means to live without access to essential medical care. For once, if you are poor, female, or from an indigenous population, you have a distinct advantage. The Cuban Revolution, led by Fidel Castro, finally ousted the dictator Batista on December 31st, 1958. Over the next several years, Cuba saw half of its doctors flee to the United States. Cuba was left with only 3,000 doctors for a population of 8 million people, and only 14 medical school professors. It had 2 medical schools at the time, one in Havana and one in Santiago de Cuba. But those who made the revolution were undaunted. They declared healthcare a human right and set out to provide care to the entire Cuban population. Che Guevara was a medical doctor, and he envisioned a national community health system that, despite tremendous odds and scarcity of resources, they established throughout the country. And by 1963, Cuba sent the first of what would turn out to be hundreds of international medical brigades to another country. In that case, it was Algeria, that had just lost all of its doctors, who were French, as Algeria had liberated itself from 5 centuries of French colonialism. Today, Cuba, with 14 medical schools across the country, now has the highest density of medical doctors in the world. It has achieved incredible health outcomes despite limited resources, primarily caused by the 60-year US-imposed economic blockade. Several of its healthcare indices equal or surpass those of the United States. For instance, life expectancy in Cuba is 78 years, and in the US, for Black men, it's 76. Infant mortality in Cuba is 4 per 1,000 live births. And for African-American infants in the United States, it's 10.97, more than twice that of Cuba. Well, back in 1999, Comandante Fidel Castro decided, after seeing the calamity that was created by the earthquake in Latin America, to establish, and the lack of medical care there, to establish a free medical school in Havana, the Latin American Medical School, known by its acronym ELAM. His concept was simple yet bold, that providing free medical education to bright but historically marginalized students who wanted to be doctors but without the financial means to do so, it would motivate them to return to serve in their communities. These students receive full tuition, housing, meals, textbooks, and uniforms. They spend 6 years learning basic sciences, clinical medicine, which is about disease in the individual, in the context of learning about public health, which is the health and welfare of the community, the environment. Special emphasis is placed on preventive medicine. Graduates who graduate from Elam graduate with a genuine social consciousness and commitment. The school's administration is committed to helping every student succeed. Since the first graduation class of 2005, Elam has trained over 35,000 doctors, mostly women, many of them from indigenous communities from 138 countries. Initially established to take only students from Latin America, it now has students from Africa, Asia, Latin America, and the United States. It is because of the friendship between Fidel and the now deceased Pastor Lucius Walker, one of the founders and head of IFCO Pastors for Peace until his untimely death, that we have been able to send US students from underserved working class minority and poor white communities to study medicine in Cuba. Besides learning medicine, our students also learn how to live with electricity outages, water shortages, narrowed food choices, but also the real meaning of sharing and collective spirit. We now have almost 200 graduates from Elam. 90% of our grads have chosen primary care, and over 65% are working in medically underserved communities. We have 10 openings for students to study in Cuba each year. We are looking for and call upon you, all of you, to help us to find eligible students to take advantage of this incredible, generous offer. You will find the eligibility requirements information on our website. Please, we reach out to all of you to say, help us to fill our slots and to help provide the medical care in our underserved medical communities here in the United States. Thank you.
Excellent. Thank you. Thank you so much, Dr. Patterson. And I know Melissa Barber, we'd certainly say that we know with the pandemic that there is certainly an opening. We've left the window open for applicants, and Melissa's still working hard on trying to cull and pull all of that together. So please, I hope that people will take you up and take us up on this opportunity and reach out to us. If they know of anybody, any young person who's interested in studying medicine, and we'll certainly be happy to follow up with them. So next we want to ask John Waller. John Waller is wears another person who wears many hats. He is another member of the IFCO family. He's in a unique position. He's the only guy, I think, that's joining the panel tonight. He's in good company, though. He's the caravan coordinator. He's got a lot of expertise in the area of Cuba Solidarity, and he's going to come and speak about a couple of other things. This is all sort of under the banner of what you can do. So John, please step forward.
Thank you, Gail. We've heard a lot tonight about how Cuba is fighting COVID-19 at home and around the world. At this moment, people in the US are cut off from that expertise because of the Trump administration's extreme hostility towards Cuba, but in the context of the 60-year-old US economic blockade of Cuba. To help build medical collaboration between the US and Cuba, and also Canada, the US National Network on Cuba, of which IFCO is a part, has come together with the Canadian Network on Cuba nations to launch a campaign called Saving Lives. You can see on the screen the exact campaign demands, but basically they call for a medical and scientific collaboration with Cuba. They call for incorporating a specific Cuban drug, interferon alpha-2b, into clinical trials, which has shown great promise in China and many other countries where the Cuban medical brigades have gone. And in ending the US economic blockade, we really want it ended totally, but at the very least, we want to see the end to the current extreme measures that have been taken to stop Cuba getting its medical supplies and equipment that it needs, and to try and stop Cuban medical brigades going around the world. To find out more about the campaign, you can go to our newly formed website, and the details are up there, but it's Saving Lives, us.cubanormalization.org. Or you can endorse the campaign as an individual or organization via the website, or through emailing us at savinglives@us.cubanormalization.org. Over 200 individuals and organizations have already endorsed this campaign, and in the one day this website has been up, the numbers have been growing fast. But to further build support, we ask that you download the campaign later from the website and send it far and wide to individuals and organizations. You can also endorse the campaign as an individual or organization via the website. We welcome support from every part of society, but we are especially looking for support from health professionals and medical scientists for a medically based campaign. A statement of guidance will be available any day now on the website about approaching members of Congress and other elected officials in support of this particular campaign. But we always encourage people to call or write to their elected officials at any time, demanding that the blockade be lifted and Cuba's sovereignty respected. So that's about the Saving Lives campaign. It's only just begun, but we think this has tremendous potential for making a difference in the coming weeks and months, but it needs your help in the ways I've suggested. But finally, to return to IFCO, we hope you found this IFCO National webinar both very informative and offering some guide to action. IFCO is wanting to host further Zoom meetings on a local or statewide basis to present to more people the kinds of information about Cuba and the blockade that has already been shared today, and to go deeper on a local level into discussion about local action. We have already held such calls in Oregon and North Carolina, and others are scheduled for Detroit and Tennessee. If you would like to talk with us about such a meeting in your city or state, please contact me, John Waller, on friendship and caravan at ifconews.org or via our website, www.ifconews.org. That's my statement, Gail. Do you want to now go over to questions?
Yeah, I think we've got a lot of good information, but we unfortunately, have gone over time a little bit. But let's see how many we might be able to get in. John, were you able to synthesize things, and can you lead us off?
Okay, I think the most important question that a lot of different people have been asking in different ways is, there's been so much wonderful information. How can it be accessed later? What websites, what Facebook pages is it going to appear on? What material is going to be emailed out? And one suggestion of, could it be aired on WBAI? So over to whoever is best able to answer that question.
Well, one thing we can say is that we'll certainly have it, the wonderful help of Cheryl Labosh and Joe Lombardo, who are our technical support, have helped us to stream this live on Facebook Live right now. So that's one place. We'll also be making sure that there's information about the ways you can access it through our website, and we'll be putting that information out on social media. We need to make sure that there is also an opportunity for people to reach out to some of the panelists to get access to information that they've got. Melissa, we're going to synthesize the information that Melissa was sharing and make sure that that's available for attendees, as well as, I think, information, we need to make sure information is available about Haitian women for Haitian refugees. We need to probably make sure that we send that information to all of the attendees. Anybody else have anything they want to add? Okay. I've been.
I'll add something.
Yeah, go ahead, Essen.
While you're doing that. No, I just want to say that I know at Haitian Women for Haitian Refugees, we've been able to, we're a tiny organization and we have a really small staff. We're fortunate to have directly impacted people on our staff. Like our TPS organizer is a TPS holder. She's only 23 years old, recent grad. And in our immigration youth coordinator is a 20-year-old who himself has gone through the whole same process that all the people in the CIGIS committee going through. And they've been a world of resources, and as I've been volunteers. But I also want to say that IFCO, has been a world of resource to our organization too, not just in recent times, but over the decades, really, since we started. And I want to thank IFCO for that, just being a world of resource, not just for to be able to produce, help put people in a position to be able to go to medical school in Cuba, such as Melissa and Sidabelli and just many more amazing doctors that have come out of Elam, but also to be there for organizations like ours. So many organizations going back decades that were working on racial justice at the very beginning in the late 60s when IFCO started as a fiscal sponsor to allow us to be able to do our work. And not only to be a fiscal sponsor, but also to connect us with solidarity support in their network. And that's really important. We've gotten a lot of all kinds of support because of that network. So I just want to thank IFCO for that and just stress the importance of supporting the work of IFCO, because when you support IFCO, you're supporting making new doctors, Black doctors that come back to Black communities, and you're supporting other organizations throughout the social justice movement as well. Thank you.
Okay, another question?
Yeah, just before, John, I'm seeing a couple people asking about the video that Jennifer Wager put together, the compilation of Elam students. We'll also want to make that certainly available as well. So we'll figure out the best way to do that, and probably either through Facebook or the website, but we'll certainly want to address that. Go ahead, John. Okay. There's several questions which relate to the future of healthcare in the US, and particularly, I think, addressed to Dr. Bassett. It's really, what should we be campaigning on in the US for a different kind of healthcare system? And how does that relate to the demand for single payer?
Well, that should be the demand for single payer. And there is an organization called Physicians for the National Health Program. And around the country, in a number of states, there are organizations that are organizing for universal health care, either on a state level, like in New York City, or on the national level, like with PNHP. So people can get involved in those campaigns to demand, universal health care through the Medicare system for all, and that would include in New York State. We now have an organization that is and has been lobbying to pass universal health care in the state of New York, which would include also dental care and eye care and mental health care and long-term health care. So that's one struggle, and a real important one, and actually a winnable one, we believe, both in the states and also nationally.
Next, John.
Okay, another health question that was that people were heard at the beginning about the disparities in the situation of the rate of infection for people of color in the US compared to white people. But there was also concerns raised that even when you take into account the different levels of pre-existing conditions, that people of color, once they went into hospital, were dying at a greater rate than white people with the same pre-existing conditions. So would somebody like to comment on that?
Oh, yes, I would like to comment. I mean, from a sociological perspective, I think that we have to structurally look at how this system is set up and how racism, historically, racism has placed Black people and people of color, particularly Black people, in a situation where we enter the schema of things at a disadvantage. And therefore, if you enter the schema of things from the point of view of coming with the rage, for example, the mental health, the impact of slavery, even at that level, and how it has translated into our very psyche, we enter into a space in this country where we are already at a disadvantage, where racism has treated us as the other, a non-existent. So you come into a society that doesn't value your worth to begin with.
Mm-hmm.
And if it doesn't value your worth to begin with, institutionalized racism sits in to the point where you're blamed. You know, you're blamed as your cause of your own problems. And so I think that that's what we're trying to get at with the question of policy. And Dr. Bassett could talk more about this. How do you shift the policy discussion to say that underlying the impact, why do Black people have, like she said, why do we have, you have food deserts all over our community. You have high blood pressure, rates of high blood pressure. You go to, a Black woman goes to a doctor and she's got to prove her, particularly she's got to prove to a doctor, non-doctors of color, and even some doctors of color, that she has pain. It's not acceptable. It's the whole mentality that exists in this country. And I think that that's what we have to break through. So maybe Dr. Bassett could speak to that, as well as Dr. Mary Louise.
I think Dr. Bassett had to leave.
Okay.
So I don't know
if I wanted to say something concerning that. I think Dr. Mila, you brought up a lot of good points, and what I find with many of our people is that we've been mistreated and so poorly by the medical system that by the time we seek out medical care, it's very late. And this is why the outreach is very important, to get out to people, because, a lot of Black people of color have grown mistrustful of the medical care system, and they have reason to not trust the medical care system, and they're not treated correctly when they enter into medical institutions. So by the time they enter in, sometimes there's a lot of time that was lost that they could have been identified earlier.
Good point. And also the medical system, as we know, is designed, it's a corporate system. It's a system that is there for the stockholders and the shareholders. It's not a system that's designed to treat people. It's about profits. And that's a critical point. And you don't hear that in a lot of these discussions, So I think this is good. Thank you, Dr. Sales. I wasn't keeping you out of this metaphor or anything.
I just jump in and just say that we just posted in the chat box a survey to rate this webinar, and we'll be following up with email tomorrow with the webinar recording and link to the video. But if you're able to check out that link in the chat, that would be great. It'll help us, I think, as we continue this conversation and figure out the most effective ways to do so. I know we're running late. It's now a little after 9 o'clock on the East Coast, We've gone a little longer than we had initially anticipated. John, are there any summary statements or questions that we can make as we begin to make our way toward closing?
Okay, well, how much longer have we got, Gail? As 5 minutes, 2 minutes, 10 minutes?
2 minutes.
Okay.
Okay. Okay, I think Fernando from ECAP stated the raw statistics on Cuban cases and Cuban deaths, but people were wondering about the converting that to rates, because the obviously Cuba is only a 30th of the size of the US population. So could anybody comment on the actual rates of deaths? And
Yeah, I posted some statistics. As of today, there are 1,467 active cases of COVID-19. There have been 58 deaths and 617 recoveries. And if you compare that to other countries around the world, this is a population of 11 million people. And most of those cases were emanated from tourists traveling from northern Italy, first located. So I think that's important for people to know that. Someone also wanted to know were there any cases of COVID-19 in prisons. As of yesterday, the Ministry of Health reported that there are no cases of COVID-19 in Cuban prisons.
I think also too, I don't know if you guys can hear me. I'm trying to speak as loud as I can, but I know that also just in terms of the percentage rates, given that Cuba is a country of about 11 million people, when we talk about active cases in Cuba, it's only about 5% of the US rate. And the death rates or deaths are only at 1.5% of the US rate as well. So I think that given those statistics, if we compare them, we can see that Cuba has done a very good job at preventing the spread from being as critical as it is in many other places here in the United States as well as the world.
okay, so Gail, can I ask one more question?
Sure. Why don't we have that be the last question?
Yeah. Okay. I think we've all been so much awe of what we can learn from Cuba and what Cuba can potentially do for us. I think a good final question would be to turn it round. People have been asking very concretely about whether Cuba can access the ventilators it needs, and I think the broader picture is what is the US currently doing to Cuba to stop it getting what it needs in medical supplies, and how do we campaign against that?
I would like to just address that briefly. There is something called the Helms-Burton Bill, which is actually a law that exists in the United States, the Helms-Burton Bill. And this bill, technically, the Trump administration has impacted a certain component of that bill, which means that no country can trade with Cuba, a country that may have had subsidiaries in another country can't trade. So one of the first things that we learned week before last was that all ventilators, Cuba cannot purchase ventilators on the open market because they're parts that were made in the US or trademarked in the US. That's a terrible thing. So what we're seeing is an attack against the country to deny trading by other countries, even though the US right now, because of its draconian relationship towards Cuba and its hostile and its inhumane approach to Cuba, it's isolated really, because other countries around the world are coming to support Cuba in solidarity in whatever way that it can. So that's why one of the things that we have to do in this country, in addition to the campaigns that John mentioned, we have to raise the issue of that we must move this Congress to repeal the Helms-Burton Bill, because that bill is what's in case that does not allow this trade, does not allow the travel that exists between Cuba and the US. And that's just in a nutshell.
Okay. Well, listen, we could go on, and there's really been a wealth of information. We knew even when we were organizing this webinar, we said we want to hit on so many different points, and we called ourselves trying to kind of consolidate things. Hopefully we were able to do that in a way that made sense. I just want to thank every person who participated, all of our panelists, all of the people kind of behind the scenes that helped to make this whole thing possible. And then, you know, of course, our students, the students in Elam, I mean, they really did a wonderful job of, despite all of what they've got on their plate, getting their little phones out and recording messages. And you could hear they were, you know, some of them were still on duty and some were in between, you know, home and work. But they got out because they knew the importance of being able to share this. They knew how important it was for audience here to understand and see and appreciate what work is being done on the ground there in Cuba, and that they're participating in. And we're just so proud of the effort that they've put into this. And of course, you know, the opportunity to hear from Melissa Barber, to hear from Seaton Billy Sales, to hear from Elam grads that are on the ground here and doing such incredibly important work and bringing that training home here to the United States where it's desperately needed, whereas Mary Louise Patterson, you know, really underscored the importance of the Elam education, the education that only Cuba can provide. So we're grateful that we had a chance to bring all of these desperate pieces together. And just want to acknowledge a couple people, Benita Rivera, who helped to with some of the advertisement work with Cheryl Labash and Joe Lombardo, as well as UNAC, for providing the opportunity to use this platform. We couldn't have done that without them. Jennifer Wager doing the film. Samira Adri in particular was one of the students who really played such a key role in grabbing all of the audio clips, all of the Elam students and graduates who participated. And of course, Dr. Michelle Frank, who works with us on the ground in Cuba, who is our lifeline. We couldn't know more about what was going on down in Cuba without having the connection with her, as well as the IFCO staff and board, and specifically, as I mentioned, Jennifer Wager and Ajamu Amiri Dillahunt. There's two Ajamus, so I want to make sure that I recognize my dear brother Ajamu Amiri. But we're grateful that you could be with us. We are definitely planning to host other webinars. So please keep an eye out. And I don't want to end without, and I don't think I have it in front of me, Joe, mentioning the Sanctions Kill webinar that's taking place on May 9th, 4 p.m. Eastern. And that's also going to be happening. And if anybody can splash that on the screen before we go, that would be great. And then as I'm saying that, lastly, I want to mention that there was in the chat box, a survey that we listed. Please take a look. If you can, grab the link for that survey. It'll help us to, we think, you know, enhance and improve our ability to bring information like this to you again. And we want your feedback about what worked, what didn't work, what additional information you can use. So make sure to take a look at that, the chat box before you sign out. Is Joe still there? Joe Lombardo?
Yes, I'm here.
Joe, do you by any chance have the blurb for the webinar on May 9th?
I don't. I thought we forwarded, but I don't have it in front of me. But it's May 9th at 4 p.m. Eastern. We'll have people from several different countries that are under sanctions and blockades, including leaders from these countries and their embassies, including Cuba, Venezuela, Nicaragua, Syria, and Zimbabwe. Go to the UNAC website, which is unacpeace.org, and get information on that.
Okay. I apologize. I think I had it, but it's sort of lost in the maze of things on my desktop. But I'm glad that you were able to share that. And we can send more information about that out as well when we send out additional information at the end. Thank you all. We had, I think at the height, what did we have? 200, now I'm losing track. I was trying to write them down. But we had a pretty sizable number at the height of tonight, and we still have over 135 people on the line. But thank you all so much. Go to Sanctions Kill, sanctions plural, kill singular, sanctionskill.org for more information.
Gail, could we also mention the May the 2nd webinar?
Yes, please, John, do that, please.
I haven't got the details right in front of me.
Okay. Shame on us. Cheryl, by any chance, do you have any information accessible? Sorry to put you on the spot.
Yes.
Yes.
Indeed. Of course.
Yes.
4 o'clock. 4 o'clock on Saturday, May 2nd. There will be a International Workers and Oppressed Peoples webinar. It will feature some of the people who are struggling against Amazon. It will feature 2 Cuban union leaders. And we're still trying to figure out how we're going to do that, but we've got them on deck. Messages from South Africa. You can find the information on, I'm sure, US, they're very good.
I'm trying to get rid of all this other stuff. I'm trying.
Scroll down.
Okay, I'm going. I can't get rid of, oh God. Anyway.
And you can also go to us-cubanormalization.org to click on that link and register for it.
Okay.
All right. Okay. All right. Let me stop that sharing. And all right. Well, thanks again. Thank you all for being here. Thank you for participating. Let's definitely stay in touch. And thank you, Michael S. Goodman, for that comment. And we will continue to struggle. Thank you all so much. Thanks for being here, and let's stay in touch. And as we go out, I'm gonna...
Xylophone.
Yes, if I can.
One of Cuba's hottest young rock, dance, rumba musical groups, taking us with Bill.